Thank you for allowing us to present our work. Peroral endoscopic myotomy, also known as POEM, is an endoscopic, single-stage treatment for achalasia and other esophageal motility disorders. Although the procedure has been performed worldwide for almost 10 years, there is no standard pathway for post-procedural care. Specifically, there is little data on whether POEM can be performed as an outpatient procedure with same-day discharge. The aim of the present study was to report our institutional outcomes in performing POEM as an outpatient procedure with same-day discharge. Additionally, we sought to determine which factors are associated with admission after POEM. We hypothesized that patients who are discharged same day after POEM will not suffer additional morbidity based on 30-day ED visit and readmission rates. We conducted a retrospective review of a prospectively maintained quality database and analyzed all patients who underwent POEM between June 2014 and January 2020 on the same-day discharge protocol. No patients were excluded. We compared patients discharged same day versus those who were admitted using parametric and non-parametric tests, and multivariable logistic regression was used to evaluate for factors associated with admission. In terms of patient characteristics, there was no significant differences except history of COPD, which was significantly more common in patients who were admitted. There were no differences in the other comorbidities, achalasia type, preoperative Eckhart score, or ASA class. However, in operative characteristics, patients who were admitted had longer operative time and a greater number of intraoperative complications. We defined intraoperative complications as any deviation in the standard operative course and included incidental mucosotomies that required clips, subcutaneous emphysema, and capnoperitoneum. Furthermore, patients who were admitted used narcotic pain medications for longer than patients discharged same day as well. In analyzing for 30-day ED visit and readmission rates, there were no differences between groups. There was also no difference in Eckhart score at follow-up. In terms of our primary endpoint, we found that we were able to discharge 48% of patients who underwent POEM same day. Of the reason why patients were unable to be discharged, the most common were delay in obtaining an esophagram, patients who suffered an intraoperative complication and required observation, and pain that was unable to be alleviated with oral medications. The remainder of the complications are shown in the table on the right and included medical complications and comorbidities, nausea, and anesthesia issues. In our univariable analysis, we found that history of COPD, intraoperative complication, and longer operative time were associated with admission. However, on multivariable analysis, when controlling for other factors, only intraoperative complication was found to be associated with admission. Our study has a number of limitations, the greatest of which was that it was a retrospective analysis, and selection bias is an inherent limitation in such studies. Also, halfway through our study period, we ceased routine use of esophagram after POEM, which certainly affected our rates of same-day discharge. Finally, we were limited to the data in our medical record, and any patient who presented to an outside hospital emergency department or was readmitted to an outside hospital was not captured. In conclusion, same-day discharge after POEM is feasible and safe, and patients do not suffer a higher rate of complications or ED admissions when discharged same day when compared to those who are admitted. At our institution, the most common reasons for admission are delay in obtaining an esophagram, intraoperative complication, and pain. Finally, we found that suffering an intraoperative complication is associated with admission after POEM. Thank you.